This ViewFinder episode is supported by UC Davis Health, where doctors, nurses, and researchers share a passion for advancing health. Learn more about their latest medical innovations at health.ucdavis.edu.
Perhaps at no other time in history has seeking healthcare so suddenly and so enormously changed. Telehealth has long been considered by many to be something that would take off in the future.
But we just didn't know that the future would come as quickly as it came and at the volumes that we saw.
Then the COVID pandemic changed everything. Kaiser Permanente reported a 3,000% increase in virtual visits. At UC Davis Health, entire clinics were converted online in a matter of days. Doctors had to find new ways of gathering data and keeping tabs on their patients with chronic disease. And psychiatrists faced an unprecedented demand for mental health therapy.
I don't think any of us have seen anything like this before.
While virtual visits and remote health options have been around for decades, most will agree it took this pandemic to make them mainstream.
I think there's no question it's been the tipping point for telemedicine.
Which begs the question, when it comes to seeking healthcare, what will come next?
The ICU room or the general ward room of the future will be your bedroom, and it really is possible.
We are going to change the way we practice medicine, and it's going to be more convenient for patients.
Telehealth is defined as any kind of health services done remotely, while telemedicine specifically means remotely provided clinical care. Both are now as much a part of our lives as the smartphones that enable it. But telehealth as a concept and a practice is nothing new.
So Angel, you and your team did just an amazing job switching the whole clinic across from 98% in person to 100% virtual in 3 days.
Peter Yellowlease, Chief Wellness Officer and psychiatrist at UC Davis Medical Center, used a primitive form of telehealth in the Australian outback 3 decades ago. Here in the U.S., telehealth has been around for 60 years.
It started off at the University of Nebraska, in fact, and was funded a lot by NASA in the early years, trying to learn how to interact and communicate with potential astronauts and practicing on Indian health reservations.
UC Davis has also been a long-time leader when it comes to telehealth, launching the 4-story Center for Health and Technology in 1992, where medical students learn how to use the very latest tools and technology for delivering remote care.
Patrick has been having about 5 to 6 weeks of a cough ever since the smoke started from the wildfires.
No matter if you're a physician, a nurse, a therapist, whatever it is, we believe that telehealth is going to be a part of the way that you practice in the future, without question.
The Center for Health and Technology houses experts from more than 24 different disciplines that are available to patients throughout the state. And they collaborate with more than 80 hospitals and clinics, helping to reduce healthcare disparities and make sure their experts are trained on the latest technology.
Upon delivery, we did need to provide a little bit of PPV and CPAP for like a minute and a half.
This is a mock emergency drill at Lodi Memorial Hospital, where medical staff are fine-tuning skills using a remote video system to connect with UC Davis neonatal experts. It allows babies who might otherwise be transferred to Sacramento to stay closer to their families in Lodi.
I started this project with just 6 cameras in a small portion of our NICU, and now all families have access to it.
Neonatologist Kristen Hoffman pioneered a program called Family Link back in 2014 that allows parents whose babies are in the neonatal intensive care unit for weeks or even months to view their newborn from anywhere. Now, all 49 beds in the NICU are equipped with webcams.
There's a login through the Family Link webpage. The nurse will turn on her end of the camera, and the family will click on their link, enter their secure information, and boom, they're connected.
As for Yellowlease, doctors around the globe have reached out to him to learn how to better serve patients without seeing them in person.
The biggest single block to doing telemedicine consults has been physicians. They have quite genuinely and reasonably thought that the in-person consult is the gold standard.
As we all learned quite quickly, there are other ways of doing things, even when it comes to seeing your doctor. Dr. Yellowlees has long believed that the day would come when telehealth would take center stage.
We've always known that some sort of big disaster would be a time when telemedicine might actually come into its own. Having said that, it's been a real surprise that it's been so dramatic with COVID.
Today's telehealth is more than just a virtual visit. It's the device that tracks your steps, the app that logs your meals, and the watch that monitors your heart rate. All examples of the many self-monitoring devices that have been on the market for years. During the pandemic, many of these devices achieved an even greater purpose for doctors needing to keep an eye on their patients' health, but unable to do it in person.
Monitoring blood pressure, monitoring blood sugar, weight scales, things that are Bluetooth connected to their iPhones and their other devices.
A solution like the BioSticker looks just like a Band-Aid, yet that Band-Aid is capturing about 7 different pieces of information continuously from your body.
Philips, the company known for pioneering digital technology, is also revolutionizing health technology with some cutting-edge professional and consumer products. Products that can send a patient's data directly to their doctor.
And that's transmitting back and allowing physicians to really use technology, artificial intelligence, different forms of software to look and see how you're doing.
It's information that can help a doctor understand how their patients' daily activities impact their health and how they might be better able to improve it.
Our patients are immunosuppressed, they have lung transplants.
Dr. Stephen Hayes is a pulmonologist at UCSF Medical Center.
We wanted to, as much as we could, keep them in the safety of their homes without exposing them unnecessarily to COVID.
At the same time, the pandemic forced the closure of the labs at UCSF that test pulmonary functioning, the primary means of measuring lung health for some very high-risk patients who need to be monitored daily.
And we decided we really need to get these home spirometers, these devices for patients to self-monitor into their hands and into their homes.
Hayes had some of his patients use a spirometer, and he collaborated with the UCSF Center for Digital Health Innovations to develop a way for patients to provide him daily with critical data without having to risk their health further by visiting a lab in person. The electronic monitoring program sends the data to his office, where they can provide immediate feedback as well as a heads up if there's a problem.
The patients would get an alert that says, hey, you've had this 10% decline. We think something may be going on. Please reach out to your nurse coordinator.
Devices like these are providing doctors and patients with information in surprising new ways. Toothbrushes that transmit brushing patterns to your dentist. Ultrasound tools that let you hear your baby's heartbeat at home.
Connected devices, tools that are actually passively collecting data from you, and also making sure that that data is available to clinicians constantly.
While many of these tools have long been used for self-monitoring, more and more doctors are now seeing the value in using them to gather data without having the patient come to their office. And they're learning sometimes the data is even more accurate when gathered from their homes.
We're just scratching the surface now in terms of utilizing those types of devices to help us better understand what our patients are doing in their everyday lives.
This pandemic has convinced people that it's doable. And frankly, there's been a lot of innovation that is making it easier.
Innovation that many admit offers more convenience to consumers and may bring healthcare closer to meeting modern-day needs.
I think bringing telehealth into the standard of care delivery today is exactly at the right time, and COVID was a catalyst for it.
For UC Davis vascular surgeon Misty Humphreys, providing a remote option for patients is personal.
So I started doing telemedicine because my grandmother lived in this tiny town in Texas where they didn't have really advanced level care. But what she needed, they could only do in Dallas, which was 2 hours away.
As a doctor, the memory of her grandmother's struggle to get care drives her desire to reach patients who have a hard time reaching her. Many live in the Central Valley or the foothills, where an appointment at UC Davis is an all-day commitment.
So can I bring vascular surgery to places rather than having to make patients come to me?
All right. Were you going to change it to D5 half or continue with the LR?
One of the ways telehealth continues to be used, actually the way it began, is to reach those patients in remote regions who wouldn't otherwise have access to specialized care. Patients like Dr. Humphrey's grandmother and Gary Sheridan.
Mr. Sheridan, how are you?
I'm doing fantastic.
Good. How's your leg been? Have you had any pain or any problems with it?
Gary is a patient who's had lower extremity wounds for almost 5 years.
You ready to lay back?
Okay, you ready?
All right, I'm gonna flip the camera here.
Okay.
Go ahead, head here and feet here. Up we go.
This is a chronic problem for him. He's going to have this for a long time. When we first started seeing him, he had probably about 5 different wounds.
Gary Sheridan lives in Lone Pine, California, a rural town on the eastern peaks of the Sierra Nevadas. It's a small community without a lot of resources, but they do have Southern Inyo Hospital. That's where Gary visits twice a week to get care from his nurses and to connect with Dr. Humphreys, who tunes in from her office 6 hours away in Sacramento.
There's this kind of idea that if you're going to see a surgeon, the surgeon needs to touch you, and you do. There are very specific things that I need to do to assess blood flow, but I've also found surrogates.
Nurses like Frankie Vidrio do a lot of the physical work, providing Dr. Humphreys with the data she needs to treat Gary.
Okay.
There's a bridge.
Making it 2 wounds now?
Making it 2.
Okay.
Considering there are huge parts of the state that don't have comprehensive vascular care, areas where diabetes, stroke, and aneurysms are common, but access to specialists is not, this kind of healthcare can be life-changing, even life-saving. But many admit it wasn't considered an option for good healthcare until recently.
I think people were afraid to do telemedicine. They were afraid of who the doctor was on the other side.
Patients like Gary will tell you it provides access to high-level care he wouldn't otherwise have.
I'm the kind of guy, I like to see people eyeball to eyeball, but this seemed to work pretty good.
For medical professionals starting their career in a small rural region, it's a chance to learn from highly trained specialists.
I love to ask questions and get her input as well so I can learn.
And for hospitals like Southern Inyo, it's a way to better serve their small rural community.
We have trouble taking care of communities that are 30, 40, 50 miles from us. So the ability to have a doctor care for someone who can't travel this far is awesome.
Thank you.
All right, Gary. See you Monday.
Gary.
See you Monday.
Have a good weekend. Stay out of trouble.
Bye.
Bye, Gary.
In the midst of a pandemic came another kind of health crisis, a mental health crisis. But teletherapy, as it's called, is offering a solution that experts say is even more effective for some than traditional therapy.
So folks are feeling more anxious, they're feeling more depressed. This is multifactorial, everything from isolation because they're not able to have the social outlets that help them with their depressive symptoms in the past, all the way to having anxiety related to the pandemic.
According to the Centers for Disease Control, anxiety and depression symptoms nationally increased from about 36% to almost 42% during the pandemic. Almost half the population has struggled in some capacity to maintain mental health. Those who were already seeking therapy found themselves forced to decide either to stop treatment that helps them get through each day or move it online. Army veteran Alan Renasco says he was one of those patients.
I served 2 tours in Iraq in 2003 and 2006, and I came home and was in society again. And it was very difficult for me to recognize that I didn't fit in as well. So I had a lot of reintegration type problems, like hypervigilance, a lot of guilt, things that people didn't understand.
For Renasco, therapy made the trauma of his time in Iraq more tolerable. He has regularly attended groups and one-on-one counseling since returning home in 2007 and found it to be one of the few things that really helped him.
It's hard to open up and to discuss the things that, that plague your mind.
When the pandemic forced his therapy to go online, he found the group meetings in particular changed in a way that made him and other veterans share more openly. and feel more comfortable. He says what many others who turned their treatment online are saying.
Being in the safe spot of your home or wherever you want to be gives you that ability to feel like I can share, I can talk, or I can just turn off the camera if I don't like it.
Renazco says the online groups are a powerful way for veterans to connect and find others they relate to when they may feel emotionally isolated in society and physically isolated because of injury, illness, or a quarantine.
Feeling a connection with anybody's been hard, but like having my group to be able to connect with and to just feel like other people are hurting too, other people, need some kind of connection as well, makes you feel not so alone.
It's really that outpatient care that ends up with the most long-term and efficacious outcomes.
Dr. Smita Das, an addiction psychiatrist, says there's another group that's finding success seeking therapy from home, those who might otherwise be in a residential drug or alcohol rehab program. Most of these programs were closed during the pandemic, a period when doctors saw a wave of overdoses. But studies have shown that treating a patient where the problem lies can be even more effective than treating them in a residential program.
If somebody isn't using a substance while they're in rehab, when they come home and they're exposed to the stress of work and family environment, it's creating that plan and engaging in treatment in that setting that's really important.
It's also less expensive and helps people maintain a more normal life, including keeping their jobs. And speaking of jobs, a recent survey found 40% of workers are dealing with one or more acute mental health conditions, a fact that is turning employers on to the benefits of telehealth.
I've been really impressed at how so many employers have really stepped up to the plate and recognized that this needs to be a priority.
Dr. Das is also the medical director of psychiatry at Lyra Health, a company that provides some of the nation's largest employers like eBay, Uber, and Genentech with benefits for their employees.
At Lyra, we break down the barriers in mental health care.
They've helped customize mental health options so employees have greater access to digital tools, self-help, physician referrals, and therapists from similar backgrounds who can better relate to them. All of this provides more options for mental health care besides the traditional visit to a psychiatrist's office, something some people are reluctant to do.
They may feel uncomfortable telling their family that they're seeking help for depression or anxiety. By being able to just so easily connect to a therapist or a physician reduces a whole lot of that.
Seeking treatment from home is something Kaiser Permanente Dr. Ed Lee says is an unexpected benefit for his patients as well.
Through telehealth, I can actually get a glimpse of their lives at home. I can see, how clean or how organized their medicine cabinet is. I can take a look at the video and see their technique in terms of using certain medications.
Doctors can also identify hazards in the home, give instructions to caregivers who can't make it to an in-person appointment, and reduce the anxiety that comes with traveling to an appointment, looking for parking, and sitting in a doctor's waiting room.
When they're in the doctor's office, it's kind of like it's our turf, but if they're at home, it's their turf, and they can be much more comfortable in terms of opening up to the physician.
All that means the physician, even through a screen, can get a better grasp on how the patient really feels and a better idea of how to help them. This is Dr. Lucian Maidan, a neurologist with Mercy Medical Group in Northern California, home to the first comprehensive stroke center in the region. And this is a stroke robot, a telehealth tool that neurologists at Mercy use to quickly evaluate and determine treatment for a stroke patient who may be miles away at a hospital ER that doesn't have such advanced services. For these patients, the right response can protect precious brain tissue in the moments following a stroke. The wrong response could be fatal.
We need to move fast to take the critical decisions, to try to save lives, to try to save the patient.
The robot allows experts to look at images of blood vessels in the neck and head to determine if the patient is stable enough to transport to a comprehensive stroke center, or if they need an immediate dose of the life-saving blood clot-busting drug, TPA. Robots are also critical during recovery.
at any neurological change or any change in the vitals or the exam of the patient, you are activated and you can immediately be there.
And that is one of the biggest benefits of telehealth today. Doctors, as well as specialists in a variety of fields, can be by a patient's side during a medical emergency in a matter of minutes, when those minutes really do count. Dr. Maidan believes in a few years, life-saving procedures, even surgeries done remotely with robots, will be not only possible, they'll be considered part of mainstream medicine.
Anything good came out of the pandemic was the fact that telemedicine is accepted by the society. It's not, considered a second-tier kind of interaction.
Clinical trials have long been the primary way researchers find out if a new medical treatment is safe and effective. They're the way we get new drugs to market and find therapies and treatments for prevention and cures for so many different ailments. But an estimated 80% of non-COVID clinical trials were stopped or interrupted during the COVID-19 pandemic, including a program at Kaiser Permanente aimed at providing breast cancer survivors with valuable tools for life after cancer treatment.
We had to immediately transition with the shelter-in-place order to being completely virtual.
Kaiser Dr. Brandy Nagel is trained in lifestyle medicine, which helps patients to navigate through behavior changes that are sometimes necessary to regain strength and remain healthy after a medical issue like cancer. The Resiliency After Cancer, or RACE program, is a year-long clinical trial requiring participants to take part in one-on-one coaching, group sessions, and physical activities, giving them continued support after their cancer treatment, as well as connection with other survivors.
There have been many large studies that have shown the benefit to lifestyle changes and intervention.
But the change from an in-person program to a virtual one was something not all participants were excited about.
So there's those of us that weren't raised with technology that are kind of a little bit, standoff from it.
Marie Wenger was one of the participants. Diagnosed with breast cancer in 2016, she was looking forward to learning how to eat plant-based, connecting with others who have been in her shoes, and building new, healthy skills for survival after cancer.
It was a year of them coaching us and helping us along and showing us, pointing us on the path. So it was the perfect opportunity.
The trial incorporated a Tech 101 course and adapted the way they track metrics, lab results, and other data. The outcome? Participants say the groups became more cohesive, the weekly meetings more personal, and more valuable for participants like Marie.
My group was very open, and sometimes we had some difficult discussions. Some was about, the breast cancer itself, and people were very sharing about their experiences and what they're going through still.
Our virtual format has now opened up the door to have conversations between primary doctors and their specialists with the patient and maybe even their extended family members, all in a virtual room together.
I think this has shown us that it can be really beneficial. So I'm more open to it. I don't mind having a medical video conference with my doctors at all.
As for the future of healthcare, many doctors say it's very promising. They see a future that's more convenient.
So the patients will have the choice whether they want to come and see us in person or online.
Technology that allows for a faster response time.
You can immediately see the patient, can make the decisions that are critical in a matter of minutes.
And ways for patients to find relief without the fear of stigma.
In terms of impact, I think this is a game changer for mental health.
Having it just flip on the camera and you're there, I think that'll help a lot of people to get over the anxiety of going to seek help.
If it goes off at noon, that should be Gary's signal that he's supposed to not be at Subway anymore.
It could also help doctors fine-tune interpersonal skills that they may not have considered in the past.
Can you build a relationship through a computer screen and with somebody you don't know? I think you can, but I do think it takes a special effort.
Will telehealth ever replace the in-person visit? Most agree, probably not.
There's no doubt that we can't do everything virtually.
But it will introduce some new ways of monitoring health that benefit doctors and patients.
And at the end of the day, we're going to be able to make decisions about the care we receive
to improve the outcomes that we want.
And many say it couldn't have come at a better time.
Now, we've been lucky because at the same time as COVID came along, we've got the Gen Z and millennial populations who are used to living their social lives like this, used to being on video and using all sorts of other media to interact.
Many in the medical world believe a crisis that forced us to turn online for healthcare might just be the impetus for an easier, faster, more convenient way of seeking it, and could, in the long run, make us a healthier society, offering a different but no less beneficial kind of care and comfort.
You're all so gentle. Thanks, Gary.
Compared to that traditional visit to the doctor's office you've always known.
If you knew you had the ability to see your cardiologist and check in about where's your blood pressure, have you been taking your medications, are you decreasing your stress? If you had that ability, I think that it would really improve our care.
It's really given some power back to the patients to figure out when they need to come in, as opposed to relying on somewhat of an arbitrary schedule that we've set up kind of for our health system's convenience, and maybe because we didn't have a better system.
The way that we practice medicine in the past has been changed forever. With that said, there's always going to be a need for physicians to be face-to-face with the patient in person to take care of the healthcare needs.
This ViewFinder episode is supported by UC Davis Health, where doctors, nurses, and researchers share a passion for advancing health. Learn more about their latest medical innovations at health.ucdavis.edu.